All right, good afternoon, everyone. We're going to present our webinar today, our overview of the Chicago Public League athletic season guidance for the 2020-2021 school year. Um, I'm going to present our Executive Director, David Rosengard.
Good afternoon, everybody, and thank you very much for joining the webinar today. We're excited to be able to have fall sports and have sports as dictated by, or not dictated, but by the IHSA and their guidelines. So we thank you for your patience in allowing us to put guidelines together and present them to you yesterday and to hold this webinar today. A couple of things before we get started, a couple of acknowledgements. I want to thank Chief McDade and CPS administration for their support in all sports for our schools and our student athletes. Sarah Sidarius and many people behind the scenes that help get the guidelines written and approved by various entities that need to go through that process. Special mention to Dr. Fox and his health team for their support, again, in return to play this fall. Clarence Carlson, Charles Mayfield in facilities and his team, principals, athletic council, chair, Dr. Kenner from Whitney Young, and also our CPS sports staff in its entirety, and special thanks to Mickey Pruitt, to Thomas Smith, to Jacob Morgan and Adam Bumpers for their extra help in getting this off the ground. Apologies if I forgot someone. A couple of things before we get into the presentation this afternoon. This is not a perfect process. These are not usual times. We're living in times of uncertainty. And one of the things that I say a lot is the only thing certain is uncertainty at this moment, in this point in time. So a lot has to go into these guidelines. A lot has to go into putting the student athletes and coaches and personnel in the safest possible manner that we can construct, that we're asking you to follow very closely as you can, to the letter of things that we are asking you to do to get our student athletes back participating. And as you see in the news every day, there are stories of successful launches, and there are stories that people have to back off. We are going to be able to do this as long as the state and the city and CPS allow us to. There are times when we might have to pause, hopefully not, and we will continue to offer these programs. We sent guidelines out to you yesterday. Those guidelines are very detailed. They really spell out many of the things that are guiding us for the fall sports. We have had a meeting with each of the sports from our regional athletic director responsible for that sport. We've also have identified a regional athletic director that will act as a point person for each school that's participating in fall sports. One regional athletic director will probably have about 5 or 6 schools. That person will reach out to you and be available to you via cell phone, and we'll ask that you provide us your cell phone of the point person at your school. And that person will be someone that you can contact for any issues that arise as you get sports started in the next day or two. We also want you to be aware that you can reach out to any of the regional directors responsible for your sport at any time for any clarifications in any way, shape, or form. We also sent out this morning a contact note to athletic directors, which gave you someone in the Office of Sports Administration for 3 or 4 areas, anything from PPE supplies to data entry to compliance and any other issues that might arise during the time that you're relaunching your sports programs. From a health and safety and welfare issue, I want to be very clear that we are encouraging our coaches to wear their masks at all times. We know we have certain things by sport where our athletes do not have to be masked during certain parts of their competition. But we are asking that when you're addressing your student athletes or your student athletes are waiting to participate, that they must wear their masks and please practice social distancing. The only way that all of this works in any way, shape, or form is that we all adhere to what we're asking you and what we're putting forth in the guidance. So you should have all the information that you need. The last thing before we start the slides is please ease into this. I know that it's great to have the athletes back. I know that some of your numbers are going up because there's athletes that are in other sports seasons that very much just want to get out of the house and participate, and that's all wonderful news. But tomorrow probably should be more of a organization and registration type day. There's going to be a lot on your plates to manage and your schools to manage, and you can get started tomorrow. It's fine, but it's not a bad thing if you take tomorrow to get organized and you get things started on Thursday or thereabouts. There's plenty of time to get ready for the competition that will start during the first week of September and all the way through till the third week of October. So thank you for listening to my opening remarks. And now if we can change, we'll walk through the slides. Change, please. So we're going to walk through preparedness, the guidelines, COVID-19, Aspen attendance, and protocols for us, and then we'll turn it over to the health and wellness folks led by Dr. Fox. Change, please. All students must complete the player record packet and be registered in Aspen prior to the start of fall sports. We sent the packet out to you last week, so hopefully you've had time to distribute that to the student athletes that want to participate. CPS sports contact information form ready for parents to be completed upon arrival at school the first day of programming. So please make sure that you have those forms, they're in the guidelines, and you have those ready to go. Sports programming staff attestation, that's your roster of staff members who will be working with your various sports program, including your coaches and volunteers. And each day we're going to ask you to attest to each other for your temperature and your wellness. We asked, I mentioned this earlier, a principal's designee is responsible for daily record keeping. That does not have to be the same person as our point person, but someone needs to be responsible and take control of the daily record keeping. This individual will be responsible for providing records of the assigned groups upon request. The reason this is so important is contact tracing. There may be times when there is a positive test or someone is not feeling well and we have to send them home. We have to know who is in your groups, and groups outside are, and we've already stated this, no more than 50. So just please get your group set. It may take a few days to do this. I understand that, but as quickly as you can set your groups, they don't have to be 50. They can be groups of 25. They can be groups of 20. They can be groups of 35. But please try and set your groups up as quickly as you can and identify them starting tomorrow. Change, please. All participants must maintain the social distance at least 6 feet apart to the extent feasible. Cloth face coverings shall be worn at all times when indoors except when an athlete's in the pool. We will be supplying your school with thermometers, signage, 2 masks, water, and other items, sanitizer. And so most of your schools have this. All of them should have it by tomorrow, and we will fill in the holes the rest of the week. Please encourage your students, if they have their own mask, great, bring their mask. They're going to receive a couple of more. If they have their own sanitizer, that's fine. Have them bring it. It can be a backup. If they have their own water, obviously not shared. You may not use water hoses or any of those items that sometimes you might be used to using for being outdoors. And then we're asking all participants to wash their hands or use hand sanitizer and be responsible for one another during participating in workouts and following workouts. Change, please. Groups occupying the same immediate outdoor space must not exceed 50. That includes your staff. Groups up to 50 must be separated by 30 feet. So that really won't come into play all the way through all the sports except probably cross country, but and well, probably not softball either. For indoor space, total occupants must not exceed 50 or 25% of the space capacity, whichever is less. Weight rooms are limited to 25% capacity. Strongly encourage that schools limit access to groups of no more than 10 at a time, including staff. And again, 6 feet apart, please, when you're together in a little closer quarters. Change, please. Staff are responsible for maintaining that daily record of what athletes are participating, when and what symptoms may be present. Athletes will be screened at the start of practice each day. So you'll take their temperature. You'll also have about 7 or 8 questions that you must ask those athletes. And if anybody is not feeling well and presents any concerns to you, you just have to send them home and refer them to the appropriate healthcare provider, their own doctor, or they may also call 773-553-KIDS for assistance in connecting to a local health center. So this is going to take a little bit of time. You're going to need to, you can divide up your staff and divide and conquer as best as you can. We're going to ask you to have a couple of 6-foot tables. And when your groups come in, that they socially distance and you get them registered. So please allow and account for that time. Change, please.
All right, Leslie, it's all you.
All right. Good afternoon, everyone. My apologies for the lateness of my presence here, but just wanted to touch on how to track attendance in Aspen for sports. As far as what's presented on this slide, staff are required to track attendance for each session in Aspen. So I will give a demo in Aspen in just a second as far as sharing my screen so that you can see where to do this. We want to ensure that all students are eligible and listed as active for each sport before creating an event. And what this means is once the athletic coordinator adds the students to a sport, you have to run the eligibility tool first in order to see who's active, who's inactive or ineligible, but all of your active students have to be active first before you create an event for practices, for meets, for conferences, and things of that nature. Events can be labeled as practices, meetings, conferences, a game. So whatever the event is going to be used for, you can label it as such. And for each event, students can be marked as attended, or you can also put in a comment for those who are not attending for that day. And I also have the link to the Aspen Extracurricular Programs user guide here within the slides. So you can click on that and it'll take you directly to the user guide. So you can see page 9 and 10 for all of the steps that I'm going to show you here. So I'll look at questions, or I'm sure that either Adam or Sarah or even Thomas can send me questions a little later if there are any questions.
There's actually one that I wanted to highlight now,
Sure.
specifically around the procedures for getting a non-school-based coach access to Aspen.
Okay, you would treat them as a contractor. So for principals, if they have a contractor that is going to be working under their school, then they would contact the service desk in order to create an account as such, since they are not CPS employees, but they have to be employed by the school in order to have access to Aspen.
Thank you. And there appears to be a technical glitch you may want to try with regard to the Aspen guide link. It doesn't appear to be working, so just flagging that one of our participants raised that for consideration when we send this out after our webinar today. And then additional clarifying question on Aspen. Do we need to use Aspen to take attendance at every practice or tryout starting tomorrow?
I will defer that to sports admin. This is just one way that you can do it with Aspen as far as tracking it with your sports, but I don't know if there are other means in order to do this, such as CitySpan, for example. I know that that has been used over the years. So I will defer to sports admin to advise as to what is recommended, but Aspen, in this case, it is available there if they want you to use it specifically for this.
We'll send out a note and follow up to everybody with those instructions. So Jacob Morgan is our point person with that, and I'll have Jacob follow up by making sure that everybody is clear on how we're going to capture that information.
All right. Okay, so now I'm going to hit the share screen button here. This is that other. Okay, yes.
Hey, Leslie, I'll go ahead and stop sharing my screen so you can
Oh,
quickly go through that demo.
Awesome, thank you. This here. All right, great. So when you log into Aspen, as usual, for those who are not new to this or for those who are new to this, there's an extracurriculars top tab. When you log into your school view, the extracurriculars top tab is here. And this will lead you for your school to your extracurricular program. And so for the demo today, I am going to choose varsity girls cross country, for example. And see, then of course you have your details of the information about the sport. You also have your students here. So as a reminder, as stated in the user guide, just make sure that you choose your filter to all records before adding students so that you can see them prior to running the eligibility tool. Otherwise, once after you do that, then they'll be active in extracurricular programs. So I'm going to go to my filter here and then all records. And I just added a few students just for this demo here. So as you can see, their status right now is registered and pending. And so I am going to choose my students and go to options, extracurricular eligibility status. And I'm going to run the tool. And this will just take about a minute. Okay, and so it'll show you who's eligible and who's not eligible. Now, of course, my students here are not eligible because maybe they may have a sports exam that may need to be updated because we're in August right now, so that's fine for now. So just for the sake of this demo, once you have your students' status as eligible and eligible for the status here, you would just go here to your events. And on the events page here, of course, I don't have any now, but if you go to the options menu and you click add, then you're able to create your events, such as practices and meets and games, things of that nature. Even if it's just a kickoff party or end of the season party, you can do that here. So for your summary here, you can just label it as practice. And then of course you would put the date here. So for each event or each practice, you would create one for the practices, one at a time here. And then I'm going to put in my time as far as, okay, it's an after school thing, so it's going to be at 3:45. I am going to put my practice at 30 minutes. And then you have a type here as far as what type of event this is for tracking purposes. So because this is a practice, I'm just going to keep it labeled as a practice here. Hit OK. And then you have your attendance tracking button that you're going to check this checkbox for to make sure that once you create an event, for each event, you're going to have an attendance page. You can also type in, mine is auto-populated because I've played around in this, so it's not going to be auto-populated for you unless you've been working in this. So my location is going to be the field, and then you can also write a description as to what this event is, what's included, what's involved, but it's totally optional. So then you're going to hit the save button. And then when you click on the events side tab here again, you're going to see that now I have a practice event logged here. Okay. And so if there's a practice that I want to log attendance for, I'm going to select that practice or that event. And now I can go over here to my attendance page here. Okay. And so your students will fall here, the active ones. Mine aren't active, but once I make them active, or once you make your students active for your sports, they will fall here. Okay. And so in the user guide, and I'll just pull it up here in just a moment, just so that you can see it for yourself. You'll be able to mark each student as attended with checkboxes, or you can put in a comment. There we go. And it's on page 9 and 10 for your reference. I'm just gonna scroll down here. And 10 here. So this is what your page would look like here with your list of students. The boxes here under the attended column would appear here so that you can just check them here. And if a student is absent, then you would click on the paper icon over here on the right-hand side, and you'll receive a pop-up box here in order to enter a comment. So it could be absent due to student illness, or they may have a doctor's appointment, or if you are tracking any positive COVID cases, for example, you can enter that here as well if needed. So then once you hit OK, as the bubble represents here, any comments that are entered after you hit the save button, it will appear as blue so that you know that there is a comment entered for that student. Once you have all of your attendance here tracked and created and you hit the save button, you can also print this roster out prior to taking attendance here by using the quick print menu button here. So then that way, maybe you might want a paper roster to take out on the field and you would take attendance there. So you would print this out beforehand, and then once your practice is over, you can come back into Aspen on this attendance page. You can check your check boxes and you can make your comments and then just hit the save button.
Contests may be scheduled with other schools within our Region 11, which includes the city of Chicago. Already mentioned group sizes to you. We are not allowing spectators to watch. So we're not also hiring lots of people to enforce this. We're going to ask you to help us enforce this and remind your student athletes that spectators are not allowed. And I'm going to leave it at that. I mean, we can get specific, but we're going to ask that they are not allowed. We ask too that you post information at your entrances around around your facility where the athletes are practicing and working out, and visual markers and cue points, check-in, as well as other signage to be readily available. And we'll be passing that out and getting that out to you here. You may already have it. Change, please. Transportation, CPS students, student transportation is suspended. Parents are required to transport students to and from athletic contests and competitions. No, that's a bit of a heartache. I know that's going to be a little bit different. Question came up earlier. Can young people, ride the train, ride the CTA? Yes, they can. Wearing their masks, socially distancing, having hand sanitizer with them. We are strongly discouraging ride sharing and carpooling. We're asking that face coverings be worn, whatever mode of transportation is selected. We know that a lot of these things are new to everybody. They're new to our student athletes. But again, if we're diligent in how we present this to our student athletes and we're positive about the messaging that we're trying to send, there's less of a likelihood that anything will arise where your school has to shut down or stop for any length or any period of time. So we're trying to avoid that as best as we can. Change, please. I would like now to introduce Dr. Fox again. I want to thank him for all of his support in guidance for the health and welfare of our student athletes and returning to play this fall. Thank you, Dr. Fox.
All right. Thank you, David, and good afternoon, everybody. I'm Dr. Ken Fox. I'm the Chief Health Officer of Chicago Public Schools. Let's get into talking about some of the health issues here. COVID, as you may know, is the illness caused by the novel coronavirus, and we call the virus novel because it's never before been seen in the human species. As a result, we have no immunity. A lot is known about the virus, a lot is yet unknown, and this slide talks about some of that. It's part of the coronavirus family. The genome has been sequenced. We know that it grows best in human airway cells, also known as epithelial cells, and better in the lower respiratory tract than the upper tract. So lower being below the vocal cords. We know where it binds and we know that it mutates. In fact, the new strain that now predominates in the US is different than, than certain other strains that were important early on in the global pandemic. Let's go to the next slide, please. So the virus is spread primarily from person to person. Remember, it's really kind of simple in a way. It's all about the droplets, who they come from and where they land. Okay, the most contagious period coincides when a person is most symptomatic, and transmission occurs between people who are in close contact with one another, that is within about 6 feet distance, and over time, and we say 15 minutes or more. Okay. The contaminated respiratory droplets are produced when an infected person breathes, coughs, sneezes, laughs, or sings. It's all about the droplets. Let's go to the next slide. I should have said too that, it is theoretically possible to get this from contaminated surfaces. You touch a contaminated surface and you touch your mouth, nose, or eyes, but primarily it's about respiratory droplets. All right. This slide really describes the different types or levels of exposure. Different types of exposure have different meanings and implications. We start on the far left of the slide with the COVID case. That's the infected person. Now, one slot over from the case, you have a first-degree exposure or direct contact. Okay, so those who are direct contacts with the case are first-degree exposures, and direct contacts must go to 14-day quarantine. If we move farther to the right in the slide, you see the second and third-degree exposures, right? These do not require quarantine. So the key thing here is you have to know who's infected and you have to know who is a first-degree exposure of the case or who is a direct contact. Let's go to the next slide, please. Exposure, may lead to transmission, which may lead to cases. And this slide shows where we are actually where we were in the pandemic. Wow, this is so out of date. When we first prepared this slide, it was like a month ago. We're now in the US over 5 million cases. And so things are marching forward. This is not over. But the key thing to know is that 80% of the cases are mild, 20% require hospitalization. We would say about 5% are severe, and the mortality is about 1 to 2%. Let's go to the next slide, please. All right. What you have to do in a pandemic is flatten the curve. Now, everybody's talking about flattening the curve. This is necessary in order to avoid overwhelming the capacity of the healthcare system. So this is shown in the slide here. The red curve on the left side of the graph is what happens if you do nothing or if leaders make the wrong choices. And this is exactly what happened in a number of states where infections have skyrocketed let's say Texas, for example, though there are many states to choose from, people gathered in masses, they didn't wear their cloth face coverings, social distance was not observed, clear consequences. The healthcare systems of major cities like Houston and Texas have been overwhelmed. You know, there are no beds, there are no ICU slots, there are not enough ventilators, and that's what happens. It's not pretty. Let's go to the next one. This is about what happened here. This is the Chicago curve, nicely flattened as you can see, but the key point is that COVID is not over. The gains that we've made can be squandered or lost, and that's why what you do matters. Go to the next one, please. Now, how do we protect our gains? I call it doing the 5 or it takes 6. Now, doing the 5 is about what you do as an individual, you know, certain basic things. It's just part of how we live now. Your hands, wash them. Face, don't touch it. Elbow, you cough into it. You maintain a force field of 6 feet around you. And if you're sick, stay home. That's do the 5. Now, take 6 is a little bit more what we would do, you know, institutionally, or, you know, on a larger scale beyond the individual. You know, we do want to identify, report, and isolate cases fast. We want to investigate the cases promptly. That allows us to find the context and to quarantine them quickly. Thou shalt not make a mass gathering. This is really important. I'll call this a commandment. No mass gatherings to the extent possible. And some of the guidance that has been provided is a way of working out that commandment in a sense, right? So we're also doing this screening on entry. Basically the idea here, keep the sick from the well. It boils down to that. And we all protect ourselves. I protect you by wearing my face covering. You protect me by doing the same. Let's go to the next one, please. This slide is really just about how easily the virus spreads. This virus spreads compared with other viruses. So COVID is fortunately less contagious than measles. It is more contagious than influenza or Ebola. Say right now, things have improved, but it is still true that COVID is still widespread in Chicago. Let's go to the next one. Now, COVID illnesses range from mild to severe to deadly. Symptoms may appear 2 to 14 days after exposure, and the main symptoms are shown in the following slides. Let's keep going there, please. Next one, please. All right, so things to be watching for: fever, cough, shortness of breath. But then there are other symptoms that have, you know, proven to be important as well. So you're tired, lots of aches and pains, nasal congestion, runny nose, sore throat, diarrhea. And these interesting ones, a new loss of taste and new loss of smell. These were all symptoms consistent with COVID. Let's go to the next one, please. If you develop emergency warning signs for COVID, you have to seek medical attention immediately. And these would be here: trouble breathing, persistent pain or pressure in the chest, new confusion or inability to arouse, bluish lips or face. Obviously, these would be warning, danger signs, emergency, 911. Let's go to the next one, please. Right, so who's at risk, who's at high risk for COVID, right? Risk is relative. Those over 60 and those with chronic conditions, like the ones listed in the slide here, would be considered at higher risk than other populations. Let's go to the next one, please. So we talked some about how important it is to identify the cases quickly. And what we'd like to do is have any employees who are COVID positive self-report to us at talenthealth@cps.edu. You will be providing certain basic information. A person should self-report, and when they do, we call the person back and we get the relevant details so that we know how to guide the school. Key things here, you know, we need to protect people's privacy, you know, and we do not share protected health information like in a regular email or something like that. and you don't investigate the cases on your own, because this really leads to great hazard and confusion. So we want to avoid that. Next slide, please. All right, so a student's report of a positive test goes not to Talent Health, but to contact tracing at cps.edu. And it's really the same sort of situation there. So it's very important to identify the cases promptly. And these are the ways that you do that. You don't just, drop an email to me or call or anything like that. These are the ways. It's really important that we do it in this way. This is the safest, easiest, most protected way to share private health information. And anything else, is really subject, like a regular email, subject to FOIA request, which means it could become public. So we don't want that. We want them only in these protected, shared in these protected, specified ways. Let's go to the next one, please. All right, so now this is something you may have heard about. There are these emergency travel orders. Travelers entering or returning to Chicago from states where COVID has surged must quarantine for 14 days. This list changes each week. It actually changes on a Tuesday. It changed today, in fact, and we'll update this for you, but be on the lookout for updates. This will appear in the, the live documents that are shared with you. The difference now, states drop off and on depending on how they're doing. The states that are on newly added now are Iowa and Kansas, and I believe Nebraska and Wisconsin have fallen off. But this is something that's updated weekly. It's updated on Tuesdays, in fact, and it was updated today in the ways that I mentioned. Let's go to the next one, please. All right. Now, it's really important that everyone be screened each day, and the screener is there for you. We like this information. Shared electronically. Let's see the next one, please. This is just some example of what's on the screener form. Let's go to the next one. It asks about the symptoms that we discussed, right? It's all about just separating the sick from the well. When we do that, we prevent the spread of the virus. Let's go to the next one, please. Right, this is another feature of the symptom screening form. And this is just about, making sure that people who are not supposed to be there, are not there. That if you've had close contact, you should be in quarantine, or you've traveled somewhere that's on the list, then we don't want you participating until your quarantine is over. All right, these are other things that are part of screening. There's also temperature screening that has to happen each day. A fever is anything over 100.4 degrees Fahrenheit. Let's go to the next one, please. Right, so we talked about the threshold for fever, and people are supposed to do temperature checks. The thermometers, they're infrared, contactless thermometers, and you use them each day to screen each person. Let's go to the next one. Right, these are just some instructions. I think everybody can look at these on their own, but it's just about using that particular infrared thermometer. Let's keep going, please. Right, there are some practical do's and don'ts with regard to cloth face coverings. Everybody needs to understand this. They're pretty practical. Make sure you can breathe through it. Wear it whenever you're out in public. Make sure it covers your nose and your mouth, and you wash. You have to keep it clean, right? You don't put it on kids under age 2. And let's keep going. This is about how to clean a cloth face covering. You can read this on your own. Let's go to the next one. The next one is about drying it. You can use a dryer or let it air dry. Next one, please. And this section is less specific to COVID, but it's something that's important for everybody to know about heat-related illnesses. This just gives some background about that. Let's keep going, please. All right, and this is just about heat exhaustion. I'm sure you're all familiar with this stuff, but we threw it in because we want people to be mindful of it. It occurs when people become dehydrated and under certain conditions. It takes a while to become acclimatized, and that's part of what the training is about. Your core temperature may be elevated, and you may have the symptoms that are listed on the slide. Let's go to the next one, and the way you treat this. You want to dissipate the heat, which means loosening up or removing certain items of clothing to the extent feasible. You go to a shady area, you rehydrate, you make sure the person is laying down on their back with their legs elevated, and you apply ice towels or cold packs to the armpits and neck. The key thing here, you want to watch somebody closely. If you notice any mental status changes, the person seems to be confused, agitated, or is unconscious, you call 911 immediately, please. Next slide. This is just about looking at the heat index, which I'm sure you're familiar with. So be watchful, and you should check each day because the guidance about what you should do, whether you can practice, varies depending on the heat index. Let's go to the next one. And this is just some resources for you. These are all vetted. These are the ones that we look at and that we recommend. And I think that wraps it up for my section. Maybe I'll turn it back over to David.
Thank you all for your attendance today. Greatly appreciate again, Sarah, Leslie, Elisa, many, many thank yous for your help in being here. And also Dr. Fox, thank you and your team and our OSA team. And good luck this fall. We'll be there to support you, and look forward to watching the student athletes and coaches just get back and compete and have fun. Thanks very much. Have a great day, everybody.
Thanks, everyone.